Hi, my name is Dr. Marjan Farid. I'm the director of the Cornea, Cataract, and Refractive Division here at the Gavin Herbert Eye Institute, UCI. And welcome to this overview of the Cornea and Refractive Fellowship Program. I wish we were in person. I could help answer questions, but I'll do the best I can to give an overview, and then please feel free to send in questions as they come up throughout the presentation. So this is a one-year fellowship program, and we accept 2 Cornea Fellows per year. Let me introduce you to the Cornea team. As you know, I'm Dr. Marjan Farid. We're joined by really an all-star cast of attendings here that you'd be working with as Cornea Fellows: Dr. Sam Garg, Dr. Matthew Wade, Dr. Sanjay Kadar, and Dr. Olivia Lee. And Dr. Sanjay Kadar and Olivia Lee are both cornea and uveitis. So as a Cornea Fellow, you actually get some exposure to management of uveitis and immunological diseases of the anterior segment as well. So some of the principal clinical service sites are mainly the Gavin Herbert Eye Institute here on the campus, Irvine campus. We have full clinic build out, as well as a full surgical center, same-day surgical center on the ground floor, and really state-of-the-art equipment, and I'll show you some of those as we go on through the presentation. We also have a nice refractive laser suite as well. The other principal sites are the main UCI Medical Center in Orange. We do have a full clinic as well there, where we service patients in the Pavilion 2, which is one of the buildings in the hospital. Or on the hospital campus. We have the main OR there. There's also outpatient surgical center there as well for patients who maybe are too unstable to have their surgery here at the Gavin Herbert building. The main OR really for patients who are urgent, who come in overnight and may need urgent surgery overnight. Those will all be done at the main OR. And then the fellows also rotate through the Long Beach VA. We have an excellent collaboration with the VA here. It's a very high volume VA. And Matthew Wade runs the cornea service at the VA. So there's a full clinic there and OR. And the fellows each spend about a half a day a week at the VA. Here's a picture of our building from the outside. Hopefully some of you will get to actually come out and visit it. But it's really nice when you enter the main atrium there. You know, if you look up, there's this artwork. It's dichroic glass that refracts and reflects light at different wavelengths. So you see at special times of the day really a beautiful you know, colors that are shining off the walls, and it's really stunning and sort of supports our Shine the Light motto. So hopefully you all get to come and see that as well. The vision of the Gavin Herbert Eye Institute really is to bring together patient care, teaching, and research on the main campus in Irvine. We are at this time the only main full service subspecialty that has their own building on the main campus in Irvine. But there is a plan for the medical center and the hospital to really build out other subspecialties in this area. So you'll hear this talked about a lot as it kind of goes through its different phases. But in our building, we have an outpatient surgical center, refractive and oculoplastic surgery centers. The top floor, there's the conferences, electronic library, a teaching resource center. We have a really nice wet lab with a nice microscope, recording devices, equipment. So really the residents and the fellows are all urged to use that wet lab. We have access to pig corneas, pig eyes, human eyes as well can be ordered through the eye bank that we work with. And so there's lots of potential to practice surgery as well. There's a translational research center in Orange County. One of the nice things is there's really the highest concentration of ophthalmic technology companies. So there's a lot of potential for collaboration with industry. And across the parking lot in Hewitt Hall, our basic science researchers who are part of our department live there. And they are really world-renowned in things like corneal imaging and immunology. I can throw out some big names if you know Jamie Jester, who's really world-renowned in confocal microscopy and imaging of the cornea, and Eric Perlman. We really have a nice ability to collaborate from a research standpoint with these really amazing people who have really a foundation in cornea. The building basics, again, we're located in the Biomedical Research Center on the Irvine campus. It's adjacent to the University Research Park, which is great for technology transfer collaborations. We're 4 stories, 70,000 square feet. There's 2 ground levels. The first one really is where the outpatient surgical center is. And the next ground level, or what we call the first floor, is the clinic site right now. The second floor above that right now is mostly shell space with plans to build that out for additional clinic space and some minor procedure room space, as well as more offices and conference areas. This build out is planned over the next 18 to 24 months. The build out also includes expanding the surgical center. So currently we have 2 ORs. That's going to be expanded to 4 or 5 ORs. The top floor, the 4th floor, is the teaching and conference spaces that I mentioned before, and the administrative offices. On the 1st floor, we have an optical shop with a full optometry practice there as well. There's a nice boutique refractive and oculoplastic surgery center on that 1st floor. And then, of course, importantly, there's a nice coffee shop there. Hopefully that will open up as things start opening up with the pandemic improving. From a cornea diagnostic standpoint, we have a lot of nice, cool toys. We have Pentacam technology in both the GHEI building as well as the Orange facility. We have iTrace, which is an aberrometer that looks at the total corneal and optical aberrations of the eye, so you can separate internal aberrations from corneal aberrations. The OPD scanner, the Marco workup station, this is also a wavefront analyzer. It's a topographer, wavefront analyzer, optical path difference analyzer, pupillometer, and camera rolled up into one. It's really fantastic. You can get a lot of diagnostic information on patients using this Marco OPD scanner. We have anterior segment OCT in both locations. We have specular microscopy in both locations. Wavefront optics for our LASIK suite. This is all going to be upgraded over the next year as well. We have the Viz X4. We have confocal microscopy as well. And Olivia Lee, who's joining us later this year, is really renowned in imaging, confocal microscopy imaging, and research in this area. So we're getting a state-of-the-art confocal microscopy as well. And so we'll have access to that. We have IOL Master 700 technologies in both locations. We do a lot of premium IOL technology as well. We have Lipiview, Lipiscan, Lipiflow system, as well as the Tear Care system for patients with meibomian gland and dry eye disease. So this is very nice thermal pulsation. I don't know if any of you have familiarity with it, but we have access and ability to use that for our patients. Here's our refractive laser suite, and that's a previous fellow. That's the Vizex excimer laser. We have the IFS to make our flaps. That's our femtosecond laser. We actually have 2 IFS lasers in the building, one in our laser refractive suite, and then we have an IFS down in the OR. That's where we do our femtosecond laser keratoplasty. And really, I think our program is one of the leaders in femtosecond laser keratoplasty technology. I don't know if you guys are familiar, but the femtosecond laser technology was actually invented by Dr. Ron Kurtz and Tibor Uhaus, who were from the UC Irvine faculty. And Dr. Tibor Uhaus still is actually in the biomedical engineering and ophthalmology department here. So we have been really lucky to have a femtosecond laser from its inception, and sort of we've been able to have the latest models and generations, and all of our clean corneas, patients who have keratoconus and who are good potential candidates get femtosecond laser keratoplasty. Here's a picture of one of our ORs downstairs. We have basically state-of-the-art Zeiss microscope ceiling mounted. We have the Callisto system, and I'll show you that. Basically every case gets recorded, and we have the ability right on the spot to go in and edit our cases in terms of video, and have those available to add on to our library and use for teaching purposes. So here's our recording system. Every case gets recorded. We have intraoperative aberrometry, aura, in both of the ORs. We have the Callisto system in both of the ORs as well. The Callisto helps put an image on the eye, as you can see on this picture, that tells us where our toric needs to go. So it makes it very easy and brainless. We line up our toric lens right with the image that's shined through with the Callisto system. The Callisto takes the upright image of the patient at the IOL Master 700 and uses scleral imaging, scleral vessel imaging to rotate. So it takes into account that the cyclorotation, and then shines that image onto the cornea, so that when you put your toric in, you can line it up beautifully. Here's our PACU. This is where the pre-op, post-op patients wait for surgery and after surgery. There's 6 beds currently, but that wall you see on your right side will come down, and then there's space to build out another 6 to 10 beds on the other side. So this is all, again, the plan, that part of the expansion phase that's going to happen in the next 18 to 24 months. Over at the medical center, again, our clinic is out of Pavilion 2, which is this building over here. Our main hospital, the Douglas Medical Center, is about a little over 5 years old, so that's also a very new hospital. The main OR is very nice as well, and they have all of the equipment we need from an ophthalmic standpoint to operate in the middle of the night when we need to. At the VA, we have Dr. Stephanie Liu, who is one of our retina faculty. She runs the VA ophthalmic division there. And Dr. Matthew Wade, who's part of her team, runs the cornea division over at the VA. So you'll work with him a lot when you're at the VA. Here are some VA residents, previous residents. They run the VA clinics there, as you may know, and you may have the same experience at your VAs. And the VA OR there has a nice, again, really state-of-the-art technology and equipment as well. And every year, Dr. Liu actually asks for more funding to upgrade all of so this picture is a little bit older, actually. So she's upgraded the microscopes, the phaco machines, everything is pretty state-of-the-art. Now, the resident and fellow relationship, I have to tell you, here at UC Irvine is a very happy one. There's every year when the residents interview, they wonder how the fellows are going to affect their surgical experience and vice versa. And I'll tell you that here at UC Irvine, the surgical volume is so high overall that there's such good collaboration because no one's fighting over cases. So the fellows are actually very helpful to the residents. You guys can help staff their cataract cases occasionally, and the residents turn over all of their complex cases over to the fellows. So it's really a nice collaborative interaction. The fellows, you guys do all of our private cornea and IOL complex cases throughout the year, with the exception of the July month, which, everyone's starting to getting oriented during that time. But otherwise, it's a really nice relationship. We have 3 residents per year, and that's expanding to 4. And there's plenty of volume for everyone. This is what the typical fellow schedules look like now. These can fluctuate from year to year depending on people's schedules and OR times and so on. But Fellow A, for example, is mainly with Dr. Garg and Dr. Wade throughout the week and spends Friday afternoons at the VA. Fellow B is primarily with myself and Dr. Kedar and spends Thursday afternoons at the VA. But again, Dr. Olivia Lee is joining the practice, so that will also change things a little bit, as we want everybody to have sort of an equal and experience by the end of the year. The fellows switch every 3 months, and we want you to have exposure to all of these great brains that are here in the cornea division at UC Irvine. So plenty of time for research as well. The fellows usually present at a major meeting at least once throughout their academic year here as well. So let's talk about surgical volume, because everyone's always interested to know how much surgery do you do. And I've taken sort of the average over the last few years and put that here. I always collect the logs from all the fellows before they graduate. And I'll tell you, our numbers are phenomenal in terms of full thickness corneal transplants and DALK, whether it's femtosecond laser or conventional. Each fellow is doing over 60 cases by the end of their year. So you come out feeling very, very comfortable with open eyes and, going through a conventional keratoplasty. In terms of endothelial keratoplasty, DSEC and DMEC, if you clump those together, the fellows are doing 30 to 40 per year. And that's divided somewhere between DSEC and DMEC. We're all doing both DSEC and DMEC. All of the attendings are very well comfortable with both types of endothelial keratoplasty. Anterior segment reconstructions. I do a lot of ocular surface reconstructions for severe ocular surface disease, keratolimbal allografts, keratoprosthesis, tectonic patch grafts. Those are done with me, in the majority of the cases, although some of our other attendings are also starting to do keratoprosthesis surgery. In terms of pterygia and CIN, ocular surface surgeries like that, we have an abundance. We're in Southern California, lots of UV exposure. So you get a lot of exposure to ocular surface surgery like that. Corneal cross-linking, we do tons of those. Intacts, we do some. I'm not a huge fan recently, but we do some, or at least we talk about when they are appropriate to do. In terms of refractive surgery, the AUPO requires 8 eyes as primary surgeon, which we get. We get over 8 eyes per fellows. Our LASIK volume is not huge. We are AUPO certified in refractive surgery. If you're looking primarily to be a refractive surgeon, which is fantastic, this may not be the fellowship for you, because we do enough to have each fellow leave feeling very comfortable doing LASIK. But what you get here and what the strength really is corneal surgery, intraocular lens surgery, with some refractive surgery as well. All cases are done with faculty teaching. We get some exposure to phakic intraocular lens technology, AKs, LRIs with femtosecond laser or manual. We do tons of those. In terms of cataract surgery, you do enough as a cornea fellow here to feel comfortable. It's like riding your bike. We hope that every cornea fellow that is applying already feels comfortable with basic phaco techniques, because it's really not a cataract fellowship. This is a cornea fellowship. But you see tons of surgery with your primary attendings. We do turn over some of those cases. You see a lot of complex. We are a major tertiary referral source for Orange County, probably the only tertiary referral source. So we get all of the complex cataracts. We get a lot of complex intraocular lens surgery, exchanges, secondary implants, iris fixation, Yamane fixation of lenses, scleral fixation, iris reconstructions, and prostheses. So a lot of really nice anterior segment complex surgeries, most of which are turned over as primary cases to the fellows. We do emphasize a nice eye bank training as well. We work very closely with SightLife and CorneaGen, and CorneaGen invites the fellows every year to go out to Seattle to have a 3-day experience looking at eye banking technology from the beginning, talking to donor families, all the way to how they harvest the donor and how it becomes available for transplantation. So you go through that entire sequence. Fellows have loved this experience. I actually went with our fellows last year, and it's really a phenomenal experience to be out there and to see it firsthand, how the eye banking works. Hopefully this year we'll be able to do that as well this coming year. With the pandemic, travel may be a little bit more difficult, but that is a vital part of the Cornea Fellowship experience as well. So in summary, really we want the Cornea Fellows to develop medical and surgical skills in cornea external disease, anterior segment, and refractive surgery. We do emphasize research as well. We want you to be involved in the clinical research that the faculty does. We're very open to having collaboration if you're interested in basic science research. Again, every fellow usually presents at least once at a major medical meeting. Usually it's ASCRS. By the time you start and have some data to present and send an abstract in, it's usually for ASCRS, which is later in the year. Peer review publications, case reports. Every year we're very productive from that standpoint as well. And we really work together as a team. So you don't need to struggle to come up with a lot of projects. We do that together as a team. We have medical students and residents and the fellows. It's really a collaborative effort and team projects that are ongoing all the time. So department activities, we really want the fellows to be involved in as well. And when you come to UC Irvine, you're not just a cornea fellow, but you're also part of this ophthalmology department. So grand rounds, M&M rounds, specialty rounds, imaging conferences. The fellows actually give some of those teaching conferences to the residents, and we want you to be really actively involved in those activities. So fellowship summary, again, resident clinic and surgery support the academic mission of the department, in particular the service of the attendings. We are AUPO certified in cornea and refractive. And that brings us to the end of our summary. Thank you for your patience with the external noise as well. We do have piano playing in the background. So this is sort of the day and age we live in. We wish you could come and actually visit us. Please feel free to reach out to myself or any of our attendings or to our current fellows. Happy to kind of get you guys connected. If you had come out for a real interview, you would meet the cornea fellows. They would actually take you on a tour and give you the lowdown of what it's really like to be a cornea fellow here. But I'm happy to make that connection for you so that you can reach out to them as well. So wishing you all the best and hoping you find the right fit, and looking forward to meeting you all. Thanks so much.